Welcome to MD Source, helping you become a more informed you when it comes to your health. With a mission to share the most accurate and up-to-date medical advice and tips for healthy living, MD Source has conversations with real doctors and medical professionals who are the experts on the topics you want to know about. Today's special guest, Kelly Hogan, clinical nutritionist and wellness manager, gives tips on how you can manage your diet. And now, here's Morgan Hare.
Hi, this is Morgan Hare with MD Source and the Alliance in Reconstructive Surgery. And I'm here today with Kelly Hogan from Mount Sinai Hospital. And Kelly, we're going to talk about nutrition today while you're going through treatment. So tell me something about yourself and your background and why this is such an important topic.
Okay, well, I'm Kelly Hogan. I'm the clinical nutrition and wellness manager at the Dubin Breast Center. I've been a dietitian for almost 6 years. I've been working with breast cancer patients exclusively for about 3. And it's something I'm really passionate about, women's health in general and breast cancer, and just helping patients live their best lives throughout their treatment, wherever they are in their treatment and beyond, and help them really navigate through the myths and facts on nutrition and breast cancer so they can feel their best always.
So if you have cancer, how important is nutrition? Nutrition
is always important. I think when you have cancer, it's going to be important regardless of where you are in your treatment. I think if you're, for example, going through chemotherapy, nutrition plays an important role because it can help you feel strong. It can help you kind of handle and manage your treatment a little bit better if you can eat well. If you can't, there are always things we can work on or strategies we can use to make sure that you're eating as well as possible during that time. I think beyond breast cancer treatment, nutrition is always going to have an important role because diet quality has been shown to be a factor in prevention of recurrence and in really reducing risk in general for breast cancer.
And how important then is good nutrition when you're going through this?
It's important. I mean, the body has higher demands for protein when you're going through something like chemotherapy, or even when you've had a serious surgery, for example, a mastectomy. The body has higher protein demands. So making sure you're getting enough protein, you're getting enough other nutrients is really important. And I think the symptoms related to treatment often make it hard to get enough of those nutrients. So working with a dietitian is so helpful in finding these different strategies to help make sure patients are getting those nutrients, even though it might not be the easiest thing for them at the time.
So when you're going through treatment, does your body tolerate all different kinds of foods and nutrients, or are there certain things that you should do or not do? I mean,
so when you're going through treatment, and everyone kind of has different symptoms. Some people may have taste changes. Some people may have severe nausea and vomiting or diarrhea. So I think in general, there are foods in a bunch of different categories that do not go well with those symptoms. So it's all about kind of navigating for that individual patient what's going to work and what's not. I think a lot of times more bland foods can be useful if you are having any sort of GI symptoms. Again, that's not all the time, every single day throughout your entire treatment course, because things change the further away you get from your treatment. Before your next one, you may feel better. So tweaks to the diet can be made throughout, and I think that's really important to know too.
So I'll take diarrhea. So then how do you know what are good food choices or not good food choices?
So in general, foods that have a lot of fiber or a lot of fat in them, or even a lot of sugar, can make diarrhea worse. And if you don't know that, you will find out if you try to eat those foods. But I think that's why it's really important to have a good treatment team, because that can be communicated to you. And I think going back to just working with not only a dietitian, but a good medical oncologist, you'll know kind of how to change your diet up a little bit to make sure you're not making those symptoms any worse.
And what about dietary supplements? I mean, there's a lot out there. You hear about vitamin D because you're not getting enough sun, or C because you won't get colds, or other things that can affect you more so if you're going through treatment. So
Sure.
how do you feel about supplements?
So my thoughts on supplements are different based on where you are in your treatment. If you're getting chemotherapy, we really discourage most, if not all, supplements, because a lot of them could either interact with different chemotherapies or in some ways kind of minimize their effectiveness, or just change how effective they are. We would never want that to happen when you're on chemotherapy. Afterwards, I think it really is a case-by-case basis. Something like a vitamin D supplement is sometimes, if not most of the time, necessary, especially for women who are at higher ages or going through menopause or taking certain medications that are necessary when you have breast cancer. So we always want to be thinking about bone loss, and vitamin D can help with that. So that's one supplement I'm usually on board with. I think the more herbal supplements and stuff like that have not really been scientifically studied, let alone approved by the FDA, or really give me pause when it comes to recommending them to patients or saying they're okay, just because we don't know if they're going to do anything harmful in the long term or the short term, and we don't even know if the ingredients listed on the bottles are the ingredients in the actual supplements. So I think it's always something to talk to your doctor and your dietitian about before you take something like that. But in general, I think usually we can get most of the vitamins and minerals we need from foods.
Right. Are there certain foods that give you more vitamins and minerals? I have recently heard watermelon is actually good for you.
Yeah, I mean, the name of the game is variety when it comes to what you're eating in your diet. And I think obviously lots of colorful fruits and vegetables have a big variety of vitamins and minerals and antioxidants and all of that good stuff. There's no one thing that you have to eat, just like there's no one thing that you can't eat. I think the best way to make sure you're getting enough of all of these different nutrients is just to eat a varied diet, and also not be afraid to eat any certain food based on like what you may have read or heard about diet and cancer or breast cancer.
Right. So I know there's a lot of different kind of diets out there, from Atkins to South Beach, vegan, keto, paleo, the zone, Duncan. I mean, these are just a few of the diets that you read about. And I don't know that everyone understands the difference in these diets, but I know a lot is talked about a paleo diet or a keto diet. And what's your thought about all these different diets out there?
Yeah, I have a lot of thoughts. I think at the end of the day, the best diet is something that is going to work for you, that you can stick with and you can do without stress and enjoy. That said, I think a lot of these diets that you mentioned are what I would consider fad diets. They're having a moment, some of them now, but I think maybe a year or two down the road they won't be, and there will be new fad diets. So I think any diet that is going to tell you what to eat, when to eat it, and kind of manipulate even your mindfulness or your hunger and your fullness cues is not something I would want anyone to follow for the long term. That just causes unnecessary stress around food. And it's super important to note, too, that none of those diets have been shown to be beneficial when it comes to cancer or breast cancer in general.
Right.
So,
are there any diets that help if you're going through treatment?
So speaking specifically for breast cancer, and this isn't during treatment if you're on active chemotherapy, but in general, the diet that has been studied the most is the Mediterranean plant-based diet. And I'm hesitant to call it a diet because that kind of sounds like, you're going on a diet or eating I don't know, raw vegetables all day long or something, but it's an eating pattern with a focus on fruits and vegetables and whole grains and healthy fats like avocados, olive oil, nuts, seeds, some fish, and a little bit less red meat, dairy products, and stuff like that. But it's not excluding anything, which I think is important to note.
And what about alcohol? I mean, can people still have a glass of wine or a cocktail?
Yeah, yes. I think in speaking specifically to breast cancer, Alcohol has been found to increase risk, and that is for anyone drinking more than 1 drink per day. So that's an important factor to think about. I think in general, you also have to live your life. And if you enjoy a glass of wine once in a while with dinner or you're going out, that's fine too. I think we have to look at the big picture over the long term.
Right.
And, if you are finding yourself having a couple drinks per night every night, then maybe that's where we would look at cutting things down a little bit. But I think there's a time and a place for everything. And I think alcohol is okay once in a while.
Right. So eating less fat or having less fat in your diet, will that help your cancer not return or help prevent cancer?
So I would say my answer is a little complicated. So historically, research on diets low in saturated fat, and those diets, those fats are fats coming from animals, like red meat, dairy products, chicken, skin, all of that stuff, have been found to be associated with an increased risk of breast cancer, and other cancers as well, other chronic diseases. That said, I don't think avoiding those fats completely is going to help reduce risk of recurrence. It's really hard to do, and I don't think it's necessary. I think more so focusing on plant-based fats. So those would be, again, the avocados, nuts, seeds, olive oil, and fats coming from fish, like salmon, tuna, is a great way to kind of refocus the diet. So you're eating a little bit less saturated fat, but you're still getting in those good healthy fats, which we know can be protective when it comes to some chronic diseases and cancer.
So does it make a difference when you're talking about fruits and vegetables if it says it's organic or not organic? I mean, I think people are confused about that, and a lot of times organic means it costs more.
Yeah. I think at the end of the day, I want people eating fruits and vegetables. I don't really care whether or not they're organic. And that's based on all of the research that we know to date. There's no difference in nutrient value. And we cannot say definitively right now that eating conventional produce increases risk for any cancer. And really, just like you said, organic produce is more expensive and it's not feasible for everyone to do. So I would never want people who can't afford it or can't do it all the time to think that they're hurting themselves by eating conventional produce. That's not the case at all. So eat fruits and vegetables. If there's something organic on sale and you can do it, go for it, but don't feel like you have to all the time.
And dietary fiber is good for you, I would think.
Absolutely. Yeah. I think, that's a benefit to eating a diet with a lot of fruits and vegetables and whole grains, is that you are getting adequate fiber, which just helps the body with regularity. It helps maintain a good, diverse gut bacteria, which can be helpful for immunity and just overall health. So I think that's one of the really important components to eating a plant-based diet, is that it is providing adequate fiber, which we know a typical kind of Western diet isn't getting nearly enough.
So talking about fruits and vegetables, we see a lot of canned vegetables especially. Mm-hmm. Is there a difference between eating fresh than eating canned?
Yeah, I would say so. Canned vegetables do have more salt or sodium in them because they're preserved. So I think making the switch, if you can't do fresh all the time or you find things going bad before you get to make stuff with them, get frozen vegetables instead. They don't contain extra sodium. They're frozen at their peak ripeness, and they'll stay, keep in the freezer for a long time. So you can only take out what you need to make. I think that could be really useful.
So whether it's frozen or fresh versus canned.
Yeah, if you can. I mean, once in a while, canned are okay, especially if, financially that's what you can do. I think, we always have to think of priorities, and right. I always like to meet patients where they are. So if canned vegetables is a reality, then we figure out how to use them with the other foods that they have or the other foods that they can afford.
Right. What about, we hear a lot about detoxing. Everything is about detoxing these days. So how does that fit in if you're going through treatment or have cancer?
So that's such a good question, and it does not. So we have a liver and 2 kidneys that do a really good job of detoxing the body. Despite the messages kind of out in the internet or media world that are trying to promote various different products that can help the body detox. And I think if you're on chemotherapy, you're really susceptible to those messages because you want to get the chemotherapy out of you. But I think taking any product or not eating or only drinking juice, for example, to try to detox the body is really depriving your body of nutrients at a time where you need nutrients the most.
Right.
So really understanding that, or, talking to your doctor or your dietitian about, if you want to do something like that, definitely talking to them first, because there are other ways to keep your body as healthy as possible so it can help you detox in the natural way that it's made to do.
And what about probiotics? I hear a lot about probiotics today. Are they helpful for your digestive system while you're going through treatment? So
probiotics in pill form, I wouldn't recommend during treatment either, because they do have a higher amount of bacteria, even though it's a healthy bacteria for the gut. You are more susceptible to infection from any bacteria when you're going through treatment. So I wouldn't necessarily recommend taking probiotic in pill form during treatment. That said, in general, afterwards, when you're done with treatment, taking a probiotic could, if anything, be helpful for digestion and just overall health, especially if you don't eat foods that are high in probiotics. And those would be fermented foods like yogurt, sauerkraut, kombucha, stuff like that. Yeah. But that's something, too, that you want to talk to your oncologist and your dietitian about, just to see what they think and make sure it's okay with all of the other treatment you're going through or medications you're taking.
So the other thing I hear about that's trending is CBD oil.
Yes.
There's a lot about that in the news, that it can help with feeling uncomfortable. What's your opinion about that?
I think my opinion is it's like infancy stage, because I guess there is some research on CBD oil, not a ton. And I think nutritionally, I'm a little bit limited in providing recommendations or advice on CBD oil. So stay tuned. I might have an updated recommendation in a couple of years.
Because you hear all these things trending in the news and you don't know how exactly it fits. And I hear gummy bears with CBD could help people with nausea. And
it's a really interesting body of evolving research, and I think eventually something like that could be helpful for patients, especially patients going through treatment. I think we always err on the side of caution, and we always want to make sure it's not going to have any negative effects, especially when it comes to making the treatment less effective or the side effects more severe. I'm not saying that's the case, but we just want to be careful before we give patients the go-ahead.
So if somebody's feeling nauseous, are there foods or something to drink, tea, whatever, that might help them with their nausea?
Yeah, a lot of times it's the bland foods that can be helpful, like toast or rice or plain pasta, crackers, ginger candy, ginger chews can be helpful for a lot of patients, ginger tea or ginger ale. Depending if they're like turned off by hot or cold liquids, we kind of tend to go one way or the other. And then honestly, I usually tell patients whatever sounds good to them, I want them to have. And if, I think if you've even ever been sick before, there are some foods that sound okay to you and some foods that sound totally terrible. So it's always about the individual. And if something sounds good to you, that's a sign that you should probably eat it.
So when you're going through treatment, it's important, I think, that you ask whoever is in charge of your treatment about nutrition. What kind of questions should a patient ask?
Well, the questions that I get most often, and I think we in general here get most often, are just what should I eat or what shouldn't I eat?
Right.
And that kind of opens the discussion to something larger. Just based on where they are in their treatment and then beyond, because the recommendations, like we've been talking about, are different depending on where they are in their treatment. But I think that just opens the discussion. And then if they know, there is a nutritionist available to talk to them or be with them throughout their journey, I think that's helpful. And there's always different questions that are going to come up, because there's always something new in the news or the media or the internet talking about nutrition. So
how often does someone come and talk to you about their nutritional needs? And what should there be? What's your expectation as a patient of, okay, I'm going to see a nutritionist. what is that about, and how many times do I go? And
that's different for everybody too. I think sometimes it gives people pause because nutritionists or dietitians are associated with putting people on diets or focusing on weight or things like that. But I think for me here, what I really focus on and what I think is really more important than those things is focusing on diet quality. And even going beyond diet and talking about movement and physical activity that we enjoy, reducing stress, sleep. I think I always try to take a holistic approach to these things. And I think talking about diet quality and making feasible changes to diet wherever the patient is currently is really important. And I think those goals are a lot more sustainable over time than focusing on any arbitrary number on the scale, for sure.
So talking about sleep, because I know when you're going through treatment, sleep is more difficult. Are there foods that you can eat before bedtime that might help you with sleep?
That's a good question. I think, they're not a whole... So melatonin, we know, is a supplement or something that the body also produces that can help with sleep. There are not a whole lot of foods with melatonin, but cherries or like tart cherry juice is one of them. So that could be useful for some people. I think having a little snack before bed that has some carbohydrates and a little bit of protein can be helpful too, even if you're just a little bit hungry before going to bed, because sometimes that can make it hard to go to sleep. Or if you wake up hungry, that it can help prevent that.
Right.
But I think everybody's different. So just like trial and error in general.
Right. And when you look for a nutritionist, what kind of background should you look for in the person?
That's a good question. I think, these days, anyone can call themselves a nutritionist, and it can be really confusing for the layperson to understand who has education and credentials and who doesn't. I think you always want to look for a registered dietitian who has the RD after their name. That means they have the equivalent of an undergraduate degree in nutrition. They've gone through an accredited dietetic internship. They've taken the RD exam. They do continuing education. They've, abide by a code of ethics, etc. That's the person who's really going to follow evidence-based nutrition research and provide the most up-to-date recommendations and not just follow trends or fads or anecdotal stories or advice.
So do you have a website, or is there a good website people could go to for more information about nutrition?
So a general website would be the Academy of Nutrition and Dietetics. It's eatright.org, I believe. And there's tons of general nutrition information. I think you can also search for dietitians based on where you live on that website. So that's probably the most helpful general website.
That's great. So do you have any, I know the last time we spoke, we talked about if you're really feeling bad and you want ice cream, eat ice cream.
Yeah.
So
I stand by that statement.
So thank you. I think it's a really important topic for people who are going through treatment, because you want to make sure all around you're doing the best for yourself when you are, and nutrition is such an important part of that. So thank you for doing the podcast today.
Of course. Thank you so much for having me.
From the team at MD Source, here's to good health and to helping you become a more informed you. For the latest and most up-to-date information on health topics, visit mdsource.com. Drop us a line, sign up for our newsletter, and connect with us at mdsource.com.